Sheridan Genrich is a degree qualified clinical nutritionist, naturopath, iridologist, and health coach who specializes in mood and digestive disorders, particularly food-related sensitivities. Who's a certified Fit Genes practitioner, nutrigenomics the interpretation of how personalized nutrition and lifestyle interventions impact genes. That's a mouthful. And also is trained in Vitae Mosaic, naturopathic functional medicine. I wish we had time for going through all of those today. But what we're going to go through, focus on, is mood and digestive disorder. So Sharon, let's get started. So you've had more than one path during your career and completed your Bachelor of Health Sciences later in life. Not too late, obviously, but inspirational. What was it that inspired you to change from one very different career to long-term and serious study? You've got quite a lot of credentials to become a clinical nutritionist and naturopath.
So thank you, Linda. I was struggling with my own health issues, I guess maybe in my teens, really, but I was never sick very often, but I understood the power of food and how it was infecting me, but not necessarily the other family members. So I had a bit of an idea and became a vegetarian in my teen years, and then anemic in my early 20s. And so I knew there was some degree of control I had over what I was putting in my mouth. But it wasn't until in my early 20s that I became a flight attendant, and I was working through the night, shift work, a lot of processed foods, and being very isolated as well. So not having a kitchen at home, and really not having a lot of even support, so if I wanted to talk to someone, it might have been the wrong time of day. So, and I had a friend that was really into yoga at that time. Like, this was back in 1997. So I'd already, was working out mind-body connection. But it wasn't until I started, like in 2000, 2003, that I went into deep, and had some help from acupuncture and a naturopath that I was seeing that really helped me when I'd gone through a big emotional breakup. So often we need enough pain, right? So this was my story. And I was in a really difficult relationship and believing a lot of what I was told. So my body was basically breaking down and giving me a lot of clues that I needed to look after myself. The calories in and out model was just not working for me, and it didn't make any difference. So, I started taking some supplements, and that was kind of it. I love learning, and I loved travel. So I spent 16 years as a flight attendant, but it was having some focus and meaning that was probably the reason that I just kept learning and adding things on. So that's why I got to a point too where health can be really confusing if you don't know what to filter. So my brain became a bit of a deletion service, and I'm very skeptical about what I would listen to and read. And I'm the type of person that can't just follow unless I feel like it aligns with and sits right in me. So I looked into different courses, and I will never stop learning. I think I've just got that mindset. And I'm always learning, even for my patients today. So it's just it's a real joy that I've found something that I enjoy, and I just have to apply what I'm also saying to my patients, though.
Life is a lifelong learning journey, isn't it, right? And the Pure Health Hub adage is we're here, but we have to own our own health journey. And I think you're the pin-up girl for that, right? So I think that's it. I think we need to start taking responsibility for our health, and there is so much information out there. You're right. That's precisely why I ended up here as well. So it's an interesting pathway, but thank you for sharing that. So you have a long list of credentials, as we were talking about before, but today I'd like to focus on the mood and digestive disorders. Now, is there a link between those two?
Absolutely. So I still remember early biochemistry days and anatomy, physiology. So I'm trained in the hard sciences, but it's really forgotten that the enteric nervous system is what connects our gut and our brain. And there's a lot of research being involved, done now towards the vagus nerve. And that's just one of the cranial nerves. So it communicates information both ways from what is in our gut to our brain and vice versa. And basically, it's sort of why I find it challenging to isolate. If someone's having mood issues, I'm always going to be looking at, well, okay, what are they eating? What are they not eating? Because that's really where our immune system, our nutrients, not just the calories. So I'm not talking macronutrients, the micronutrients that produce brain chemicals. They're actually the process starts in the gut with absorption and also to do with the nervous system and like serotonin, for example. 90%, that's our happy feel-good hormone, 90% of it's made in our gut. And so if our gut is inflamed, if we're not getting the nutrients, like the micronutrients that we need at the right levels, and we're eating a lot of processed foods, it's going to burden the detoxification that goes on in our gut and our liver. And then we're just going to feel either low energy, it can lead to anxiety, depression. So it's a cascade of things. Nothing's
fascinating, isn't it? And this is the thing, and there's no one size fits all, right? So it's not like you can say, well, I've got inflammation in my gut, and so therefore I'll just take X, right?
Yes.
So you really need to get that specialized, consultant to go through it with you. Fascinating. So what is a digestive disorder? I'm struggling with that today. And what is the common cause?
Gosh, that's a can of worms. We've got viruses, bacteria, and yeast that live in all of us. And ideally, you want to have a combination of not many viruses or none, and then the good bacteria dominating the bad bacteria. That would be ideal. And then the yeast can be overgrown and take advantage when the bad bacteria take advantage. So I guess I'm just giving you the idea of what the terrain, what we call the gut environment is like. And then on top of that, if you have some damage, we call it leaky gut or intestinal permeability. It's basically going to let inflammatory molecules into your bloodstream. And then your body's always trying to protect you. That's what I try and remind myself and my patients, that if we're getting symptoms, it's a clue to say, we should pay attention to this and maybe try and figure out why it's happening, rather than just like suppress it and ignore the symptom, because it's actually something I would like lean into. And so there's some things that I remind people about that are quite safe for most people. There's no one size fits all, but there's some pretty common ones that I see, especially when people are starting their journey on maybe a standard Australian diet, and they're probably got a lot of inflammatory things that they're not even realizing is actually making their gut worse. So
very true, isn't it? I mean, inflammation, I know obviously we've been talking about it for a long time, but I don't think we've it understood the impact it can have on our body.
Yeah, and just, I guess don't know if I answered what question it was, but the bloating, the gas, these will be the symptoms. It might also be bowel, like constipation, diarrhea. They're definite clues there's not something good going on in your gut. But yeah, I would say also brain fog is pretty common as well, and not necessarily thought of as being something that's happening in the gut.
Well, we often just think it's just either a sign of getting older or overwhelmed or whatever it might be. And it can be, it can be many things, can't it? Really come from anywhere, which is the process of elimination. So, yes, you talked about the outcomes of ignoring it, which was what you were just talking about then. So then when we talk about mood disorders, so what are they? And are they usually genetic, or can they develop over time? And if so, what are we doing or not doing to increase the likelihood of developing a mood disorder?
Yeah, well, I guess I'd answer yes to both of those questions, because there is a combination of genetic susceptibility that will lead someone more prone. There's childhood experiences, so adverse childhood events. There's a questionnaire people can find, and at different times I will use these therapeutic tools to be able to just see where someone's stuck. But there's also usually nutrient imbalances. And often I see protein deficiency is probably, so your brain needs good fats and it needs protein as the building blocks of our neurotransmitters. And yet we're in a carb-dominated society. So I was one of those people too, and no wonder I was suffering as well.
Yeah, we do. We really do live in a carb-dominated society, no doubt about it. So is there something else that we could be doing, or that we should be doing? And obviously there's exercise and things, but in terms of nutrition, is there anything you can sort of impart there about what we could be doing or eating or drinking that would help those mood disorders?
Yeah, so when I'm working with patients, I'm usually looking at what methods, what things that they can do, the what, but I also want to remind them of how they're doing it. So even before that, I'm trying to lay the foundations and say, are you sitting down? Are you eating slowly? Are you breathing and not taking too much air in while you eat? So once all that's checked, I can say
it sounds simple, but it's so not.
I get stuck with that too. So it's lucky that I get to remind other people, and then I do it myself. But yeah, so assuming those parts are taken care of, and then I would be looking at, okay, has the meal got enough protein based on the person's body weight? And then vegetables. So have they got enough leafy greens, especially, because that's going to help not only the gut bacteria, but also with detoxification and compensating for the genetics if they don't have certain enzymes that convert something into something else.
Sorry.
Well, I guess
I was just thinking, so we were talking about genetics then, and of course you can try and work with those genetics by eating, say, cruciferous vegetables, or consistently, obviously. So that can have an improvement on the genetic disposition to a mood.
Yeah, definitely. Yeah, and food is information, so it's never neutral. I wish it was, but it's what you're adding, but also what you're avoiding. So that you can really have the best impact, and also that you're not necessarily going to see this change within 24 hours. The gut bacteria can start to change within a few days, but it's that consistency that then is going to gradually reduce the inflammation. So natural medicine is a lot more gentle, depending on what you're talking about. Like if you're talking magnesium and certain minerals, but it's not going to have that instant effect like a painkiller would, or a medication that's working on a receptor. So whereas this is it's the foundations of keeping things safe, but it may just be a little bit of a slower and more consistent, like you said, process, because the results are going to happen, but it's not necessarily where you'll want the first thing. Like if someone's trying to lose weight, it's like they've got to get healthy, then the body will relax and let them lose weight. But if it's not healthy, it's always going to be holding on and saying, fix the nutrients deficiencies or the blood sugar, then we will let go. So
well, exactly. And I'm a proponent for science, but I'm also a proponent for holistic health. And I think we seem to have really gone down the path of, or just quick get to the doctor and they'll give us a painkiller or we'll do this or whatever, which is such a stopgap and actually can be, but it's necessary. And some people, we need to take these things from time to time. But I think what I'm trying to also remind us all of is that by taking ownership and being consistent in things, and I mean, you've just, reiterated that. So on your site, Better Brain Health, which is vitally important at this particular stage of life, you talk about creating a biochemical balance to improve mood, sleep, and stress levels. Can you explain this a little bit more?
So I guess this is where functional medicine differs to conventional medicine, which is generally, like you said, looking at symptoms and pathology, so study of disease. Functional medicine is more the biochemical systems-based biology. So it's looking at the function of major organs or the underlying causes. And yes, like I've got a lot of patients that are still on medication, but they're supporting whatever they're taking and allowing their body to not accumulate more toxins because maybe their liver has to process more medications. So I'm very much about don't change. I'm just here to support or fill in the gaps, and depending on where someone's at. So it's really individualized. And that's where the biochemistry supports also the talk therapy. Like if people are seeing a psychologist for working through relationship challenges or childhood issues, one of the first diagrams that I use in clinic is a picture of the brain and how I work on the biology area, because it makes the talk therapy more effective when the brain's not inflamed or nutrient deficient. So if people are having coffee all day, skipping meals, no protein to build their neurotransmitters, and then wondering why they can't make those behavior changes, I'm like, well, we got to kind of fuel you better, because it's like getting in the car with no petrol. So it's going to be really challenging.
Right, exactly. And I think, for women in that, perimenopause, menopause, postmenopause, when everything's going on and the hormones are doing strange things, and women have this kind of unique, hormones are not just a one size fits all, as we know. So how does, what can we be doing to enhance our brain health over this period?
Okay, good question. So it's something that I'm looking at. Well, what does the biology of the body need first? Not just what your eyeballs, and you want to, I can do this because I'm a foodie too. I can make it taste good, but for most people. But I also want to make sure that the nutrient for the cell and the bacteria are met, because then the body will switch off the alarm bells. So it would be looking at, like I said, protein based on body weight, and that's individualized. And that's usually from clean sources of protein. So removing the steroid hormones, the antibiotics. Conventional meat is a different story to looking for hormone-free meat. So, and fish. So omega-3 is an essential fat. And so salmon being a low mercury fish, easy to find in our supermarkets, because your brain is mostly fat. So that's one I would be making sure as a protein box, but also a omega-3 source. And then also that coupled alongside plenty of low starchy vegetables. So that's like a good foundation to start with for hormone health and anti-inflammatory diet, low histamine diet.
And when you talk about it like that, it's quite simple, really, isn't it? It's like the protein and the veg, whether it's salad, whatever the protein is. What is yours? I'm just going to go off here, but what is your recommendation in terms of animal protein versus a plant diet, and how, what would be the balance there, for an ideal balance for a woman at this stage?
Yeah, and I work with a lot of vegetarians or vegans, and usually one of the first questions I'm asking is, what's your reason for being vegetarian or vegan? and then I'm supporting whatever choices they make. But if it's for health reasons and they're not healthy, I actually prefer them to understand that their biology should be addressed first, and at least looking for ethically sourced, maybe organic eggs, because they don't tolerate the types of feed that the chickens have been given. Chicken eggs have, in eggs in general, have choline, which is a very important micronutrient for the membranes of our cells, our fat cells. So it's got some basically medicine-like effect, depending on whether you get a good quality egg or a poor quality egg. Then I would be like looking at other sources of, like where the micronutrients are missing for an individual. But the vegan products are probably, if you look at the ingredient label and there's foods on ingredients you don't recognize, they're probably made in a laboratory. And that's where I'm saying to patients, actually be careful, because it's a buyer beware society. And when we don't know that those foods aren't made for health reasons, they're actually made to sell a product, just keep that like in mind, because a lot of those numbers your body doesn't recognize and break them down, and it's still taking the space for what is, like, have you got protein, have you got vegetables? And vegetables definitely a carbohydrate source, especially sweet potato. And but it's doing it in a way that isn't just looking at it separated. Food can be creative, and it can be an art form that is fun, and getting kids and family members involved as well. So it's a learning skill for most people, and me included. It's not something that is necessarily learned. Well, we don't learn it at school, right? So nutrition wasn't something we did at school. So it's no wonder, and just allowing that space for experimentation is a really nice way for people to just be able to lean into empowering themselves. Like, I love that about your motto, because they're taking then the power back in, while they might still be addressing the symptoms, but they're also then saying, while I'm doing this, I'm actually still going to get the foundations of good health laid, and know that I can choose. I've got that reset button at any time.
Yeah. Exactly. And I just very quickly on those vegan products that you were talking about, I mean, obviously veganism is fine and great, but those products that are in the supermarket that are packaged, and they're all basically a fast food vegan, right? I mean, so it doesn't seem to have the same level of nutrients or a similar level of nutrients that a carnivores fast food would have. It's interesting. I just wanted to get that in. So I think just finally, we talked about functional medicine actually, and obviously that's what it's, where we really need to get to in terms of the conventional. It is getting that balance right, and obviously being able to sort of peel away those medical and pharmaceuticals that we often need, but I think we rely too much on them. So I think with better brain, sorry.
I was just going to say too, some of the testing that isn't offered to patients is where the functional medicine testing, once people have done some of those foundations, it's not like America is much more advanced than with the functional medicine testing, but we actually have agents here that I could access for a patient and say, okay, we want to do a hormone test. We'll look in your urine, and you've got to look in the right places in the body. I treat a lot of small intestinal bacterial overgrowth. You don't see that in the stool. You see that in the breath testing. Yeah. So it's like someone's asked the right questions, get the right testing for that individual, and then you'll actually be able to change the treatment outcome and the results for someone as a patient.
Yeah, exactly. And I think that's the point also about medical. Obviously, they don't have limitless time and access to everything for us to be tested for everything. So again, it's about exploring those other options. Oh, Sheridan, it's been such a treat to talk to you today. I look forward to another opportunity of doing that. But thank you for sharing, your deep knowledge, particularly of mood and digestive disorders, which I think is a big issue for women in our demographic. So thanks for joining us today on Pure Health Hub. Have a great day.
Yeah, thank you. I'm so grateful. Thanks for having me. See you later.
Welcome. Speak soon. Take care.